What early dementia signs are often mistaken for aging? Sometimes it feels like forgetfulness and confusion are just part of getting older, but some early signs of dementia can look very similar to normal aging. Recognizing the difference is important because early diagnosis can make a big difference in managing the condition. For example, forgetting recent conversations or appointments occasionally is normal, but if someone keeps forgetting important dates or repeatedly asks the same questions, it could be a sign of early dementia. Normal aging might cause minor lapses in memory, but these do not usually interfere with daily life. Difficulty with routine tasks is another sign that can be mistaken for aging. If someone struggles to manage their finances, follow a recipe, or complete familiar chores consistently, it might be more than just aging. Usually, normal aging involves occasional minor difficulties, but persistent trouble with these tasks could suggest cognitive decline. Confusion about time or place is common in both aging and dementia, but in dementia, this confusion tends to be more severe and persistent. For example, losing track of the day or forgetting how they got somewhere can be signs of early dementia. Language problems are also common. If a person has trouble finding the right words or following conversations more often than before, it could be an early sign of dementia. In contrast, normal aging might cause occasional pauses in speech, but not ongoing language difficulties. Misplacing things is another tricky area. While everyone misplaces keys or glasses sometimes, people with dementia may put items in unusual places and be unable to find them again, sometimes accusing others of stealing. Normal aging usually involves misplacing things but being able to retrace steps to find them. Changes in mood and personality are important clues. If someone suddenly becomes more irritable, socially inappropriate, or shows signs of apathy, these can be early signs of dementia, especially frontotemporal dementia. These changes are not typical of normal aging, which usually does not involve significant shifts in personality. Poor judgment and decision-making are also red flags. For example, making risky financial choices or social mistakes more often than usual can point to cognitive issues rather than normal aging, which involves occasional errors. Finally, trouble concentrating and feeling confused more often than before can be signs of mild cognitive impairment, which sometimes progresses to dementia. These symptoms tend to worsen over time and interfere with daily activities. Because many of these signs overlap with normal aging, they are often overlooked or dismissed as just getting older. However, persistent or worsening problems should always be evaluated by a healthcare professional. Early assessment by a neurologist or memory specialist can help determine whether these signs are due to dementia or other reversible conditions like depression, medication side effects, or vitamin deficiencies. Remember, dementia is not a natural part of aging. If you or a loved one notice ongoing difficulties that interfere with daily life, seeking medical advice is essential. Recognizing these early signs can lead to earlier diagnosis and better management options. Being aware of the differences between normal aging and early dementia helps ensure timely care and support.